Thank you, Maya. I appreciate that. And I'd like to welcome everyone. We have really nice attendance today. We expect nearly 200 people on from really all over the United States. So really excited to see the large attendee group. The attendees have a pretty broad background too, different roles in compliance, internal audit, CFOs, et cetera. So really glad you could make it today, and hopefully we can provide some insight from our panel. Today is really the first in a four-part series that Eide puts on around healthcare and healthcare risks. We've done this for the last several years. This year, you can see what the series looks like. Today we have the real fortune to have some executives in the risk area talking to you. We're going to talk a little bit about staffing shortages at our next session, as well as automation, healthcare finance and revenue cycle in a third session. And then finally, OIG compliance program updates as we wrap up our fall webinar series on risks. We'll probably touch on some of these today in our webinar, and certainly delve into some of these in more depth as we move down the line on these webinar sessions. Given the fact we have such a broad-based group of people here, many I know are clients of the firm or work with Eide Bailly. Many probably haven't. I thought maybe I'd give a little background on, first of all, myself. I will be the moderator today. I'm a partner in the Minneapolis office of Eide Bailly. I've got 30 plus years of experience working largely with our larger client base and health systems. I also head up our health system segment. Eide Bailly, and sometimes we're very modest about our firm and our healthcare practice, but we've invested pretty significantly in healthcare. We've got over 400 professionals working in healthcare, 300 professionals firm-wide. It's our largest industry practice, working out of 40 plus offices, and we've got 150 plus different competencies working in healthcare with actively over 13,000 projects on an annual basis. The segments we work out of are health systems, rural critical access hospitals, senior living, and ambulatory care. So we kind of go to market in those four segments so that we can really address the issues of those particular areas. I guess we're going to jump into polling question one. As Maya said, we'll give you a minute here to answer this question, and I won't go ahead and read it, but we're really trying to get a little bit of perspective on risks in your particular organization.
All right, we do have our first polling question up. If you are here for CPE, please make sure you are answering these polling questions. Make sure your slides box is maximized. You will click on your selection right there on the screen, and then you will scroll down just a bit and hit submit. Please make sure you are clicking submit after you make your selection in order to receive credit. And we'll keep this up for a few more moments and then we will continue.
Great, I'll give it a minute or two. As I was mentioning, and the next slide I won't really cover, but once we've got our responses here, we do have over 150 competencies. Next slide, I'll give you a graphic of that. You can take that home and look at that at your own leisure. Certainly from our perspective, we think we've expanded past audit and tax and really handling the business of healthcare and helping you with your operational and risk issues, quite frankly. I think we need just a minute or two to get a few more responses. Maya, is that right?
Yes. All right, we'll keep it up for a few more seconds, everyone. Please make sure you are submitting your answers. Make sure you hit submit, and then we will continue. All right, we are set.
Okay, just a few comments here. Well, this is actually good background as we move into this to hear about what you see as some of the major issues here. And I think this will lead quite nicely into the next few slides, quite frankly. This is the graphic I mentioned about our healthcare focus. I won't spend any time on that. The infomercial you've heard already. Today's topics, as we dive into this a little more depth with the panel, will be around industry risks, certainly regulatory compliance and resource constraints. We just heard about some of the emerging economic headwinds, and we'll also talk a little bit about board governance from a risk perspective. And each of our panelists brings some unique background in those areas. With that, I think I'm going to have the panelists introduce themselves. And maybe we'll start from top to bottom. And CJ, if you wanted to lead us off and just give a little background of yourself, your organization, and role.
Sure. Hi, I am CJ Tanazi. I have been with OSF Healthcare for a little over 2 decades now. We are a fairly larger sized healthcare system, about 15 current hospitals, what seems like a never-ending number of physician practice offices. I support pretty much everything that has to do with dollars and cents, so strategic reimbursement, accounting, finance, coding and reimbursement, all aspects of revenue cycle, and particularly focused on the provider-based role right now.
Thank you, CJ. Christine?
Hi, I am Christine Bachrock. I am the Chief Compliance Officer for the University of Iowa Healthcare. We are a large academic medical center. So we have, and we are a state institution. We are part of the University of Iowa, so we sit under one tax ID. And we have about 1,600 providers. And we also have, besides our typical hospital and physicians, we have some separate businesses also that sit under there.
Great. Jenny?
Hi, everyone. I'm Jenny Cravens. I am currently I'm an executive professor of accounting at Central Washington University, but my background is in industry. I started in public accounting and spent 20 years in the banking and finance industry. I got involved with Confluence Health, which is the healthcare organization that I'm on the board of, about 11 years ago. I was on their foundation board for 4 years, and I'm starting my 8th year on the board. And I've been a member of the finance, audit, risk management, governance, and CEO selection committees. And I thought that finance, the reason I went into finance is because I love the complexity of the industry. It doesn't hold a candle to the complexity of the healthcare industry.
Jenny, that's so true. Kind of working in healthcare, some of the challenges that we're all facing. So I appreciate that input. I'm just going to hit a couple things, maybe taking off my introduction on some of the issues that we have seen, and frankly from other resources that we look at, advisory board, Becker's, et cetera. Lack of resources that came through in our poll panel, front and center. Financial pressures. In fact, I just saw in the Q&A someone mentioned the pressures of increased expenses, but yet revenue staying not being able to adjust revenue at the same level due to the nature of the payers. Regulatory environment. I think we'll hear a little bit about that. Certainly, there's always uncertainty with political changes, and there's been some newer regulation that have come out with respect to No Surprise Act, price transparency, provider relief funds. All those things are things that continue to add to the risk profile of an organization. Organizations are dealing with capital planning. Certainly, what and how much to spend from a physical plant perspective, how to finance that, and really how to invest, their hard-earned assets in the right manner from a long-term perspective. And then of course there's continuing transaction activity. We hear about the mergers, the really large mergers, but there's a lot of other things happening in that area as well, including joint venture arrangements, kind of some of these tuck-in type arrangements of specialty services. Frankly, organizations have looked really hard at service lines and potentially divesting things that maybe don't make sense from a longer term perspective. So all those things are part of the risk profile or the risk management challenges, I should say. kind of taking off that, this is a little bit of background information some people in our firm identified from public sources, things that really tie into the nature of the healthcare industry. 40 plus recent closures, hospital closures in the last year or so. Healthcare job cuts have increased more than 100% in 2023, meaning they doubled from 2022. We certainly have seen a lot of that reduction in force matters. Having said that, organizations, a significant amount of losses when you go look across hospitals and health systems, and struggling with nurses, nursing shortage and other provider shortages. So all those things are kind of really interesting dynamics and create some of the challenges that our healthcare leaders are facing today. Current industry state, we've generally talked about these. I probably won't go back through them. You can take this back with you, but I think the competitive landscape is one maybe I'll point out as well. Certainly, health system or hospital competitions out there, but there's also competition amongst providers, including health systems competing with specialty hospitals, ambulatory surgery centers, and frankly, some of the seepage that can occur with other providers that you see out there, the Walmarts, et cetera, that are providing certain services as well. So those are also things the industry is faced with. And then finally on this page, we talked a little bit about resource challenges. I think the other piece of the resource challenges is workplace issues. Safety has become more of an issue, and that workplace balance has become an issue. And I heard one person speak recently and said the issue isn't so much there's the healthcare workforce has shrunk, it's just that it's moved into different areas, meaning moving from a hospital setting to maybe some other setting where the work-life balance is better from the standpoint of more of a 9-to-5 job, those ambulatory surgery centers or specialty centers. Then, of course, data and information security. You can't really open up any type of news media these days without seeing high-profile cybersecurity issues, and healthcare certainly seems to be at the forefront of those, unfortunately, and really be a target in some cases. So all those things have really created challenges for healthcare leaders and for those involved in compliance and risk assessment. So with that, I think I'm going to move into our panel discussion. And Maya, you might want to give the audience instructions on how to minimize their screen so they can see the panelists as we go into some of the questions.
Okay, everyone, you see our the media player box to the left-hand side. You can go ahead and maximize that box so you're able to see the panelists. All right.
Great, thank you. Well, I'm going to kick it off. Really a general question for all of our panelists, and maybe I'll start with Christine. If you want to talk a little bit about just provide an overview and just general observations of the risk landscape, particularly from your role and in your organization.
So I think as the Chief Compliance Officer, my point of view as I think about risk in my organization is really centered around that idea of our piece about looking at making sure that we're thinking about what is the potential for the next government investigation and making sure that we're heading that off. And I think that's particularly true of not wanting to be, as many of you may be aware, sometimes the government, in order to get organizations to pay attention to different regulations, they will have an investigation where they're trying to make a point of that initial investigation so that everybody else will fall in line. And certainly right now, I think Scott's already mentioned it, is this idea about particularly the Office of Civil Rights under HIPAA and the FTC around electronic tracking technologies and sort of all the pieces that are coming out from the government that honestly, until about a year and a half ago, I just didn't even have the background to understand all those pieces. And so that's been one of our areas of focus, trying to think about in that larger context. I also think for our organization, generally we're focused on where is the revenue coming from. So of course that's generally the hospital's services, but we also have enrolled in Medicare and payers. We've got retail pharmacies, we have DME, we have home health, and those smaller important businesses from a management of the patients, but they are all much smaller, but they all have their own set of rules that are very important that then become, they have less executive attention and therefore have a higher chance of risk of something going awry without anybody realizing it, because the accounting controls and all those things, they don't catch those things in those smaller businesses.
Christine, could I ask you just on HIPAA in particular, talk a little bit about that in a bit more depth for the audience as to what you're addressing or things you're starting to address?
So how this started from my knowledge perspective was in June of 22, there was an investigative journalism article from the markup that talked about metapixel, so Facebook's metapixel ad tracking that was present on healthcare sites. And so that was in June. And then subsequently there were, as you might imagine, a set of lawsuits, private lawsuits against organizations that had metapixel. And then in the late fall, the Office of Civil Rights, who is the enforcement agency for HIPAA, came out with guidance, so not regulation, but guidance around electronic tracking technologies is the, I guess, the overarching term for all of those metapixel, Google Analytics, sort of all those things that exist on websites that are sitting in the background that we as consumers are not necessarily paying attention to in terms of that, but it is the stuff that is tracking us from website to website that then is feeding into a larger profile that all of the ad agencies then that are selling our data have. And the OCR's piece around that is that they believe that if you have an IP address associated with a person, even if we don't keep their IP address in the electronic medical record, that the ability to track them, that information, that IP address being sent to a third party could be a violation of HIPAA. And so that is really they're pulling those things together, which we have not traditionally thought of as one and the same from that perspective. And so I think that has been a new frontier for a lot of organizations in terms of thinking about risk.
It's really interesting as you talk about that, Christine. It just seems like that opens up proverbially a whole can of worms. You start looking at that particular situation and all the different or similar things that could happen in an organization. When we talked about this in planning, you start going down a path of really needing to be pretty vigilant around, privacy and security, that perspective. So, great. We'll probably come back to maybe that and some of your other comments later, Christine. CJ, did you want to provide any thoughts on overall observations, particularly, areas you work in or focus on?
Yeah, I think, and one of the things that Christine mentioned, which is a very good point, is reimbursement and where that reimbursement is coming from, because that's how we stay in business and continue to render care. But there's a lot of different nuances to being appropriately reimbursed for the care that we're providing. And when you look at just the healthcare landscape over the last few years with COVID, telehealth kind of launched itself 15 years forward into the future from where it had been. And there are a lot of inherent risks with telehealth. We had the 1135 waivers up until May of this year that allowed a lot of flexibilities with complying with those requirements. But now that those requirements are being, or those flexibilities are being rolled back, there's a lot of potential vulnerability into those payments that you're receiving for telehealth that's being rendered. And one thing that I don't know that a lot of particularly leadership are very cognizant of is, for example, if here in the Midwest, behavioral health is kind of it's a drought. There's a provider drought. There really aren't that many behavioral health providers. But when you're looking at contracting out-of-state telehealth providers, there's a lot of complexity with the Medicare enrollment and billing to the MAC where that provider is sitting when services are rendered. You're not billing to your home MAC. A lot of extra hoops to jump through. So that would probably be one of my top risk areas right now. And secondarily, with the climate on Capitol Hill relative to site neutralization and the provider-based rule, there is a lot of money at stake, a lot of payment at stake for a lot of providers and a lot of systems that could be at risk if some of the elements of the provider-based rule are altered or changed ultimately by an act of Congress.
CJ, that's, in fact, on one of my slides, I had remote on there, which covers telehealth. And I know our firm and some of our revenue cycle folks have gotten a lot of questions around telehealth and the rules and what things you have to navigate. Have you, built out any kind of compliance plans or monitoring plans or other things, or is it education for the most part?
Yeah, we've actually formed I actually sit on it, and it's a telehealth standing work group. We meet weekly, and with a system of our size, obviously, we're getting asks for telehealth delivery from every which direction. And it took us a long time to figure out the build, because in addition to billing to that MAC, we're also required to report the address where services were rendered, which would be that if that provider in California is working out of a home office, we have to report that address on the claim form. And we're obviously we're on the Epic EMR, which is one of the larger ones, and even that functionality there were nuances to it that it took us months to figure out how to kind of build a combination of claims rules and drive other things from what's called the SER record in Epic to get to a point of automation where we had mitigated enough of the risk to be comfortable in expanding that telehealth delivery. We have, over the course of the last probably 18 months, expanded on that exponentially, which has been great. But it does require probably, I would say, more than twice the amount of normal Epic department build for a typical build for, say, a new service line or a new department.
Well. So and I want to move on, but one quick question for you. Obviously, organization the size of OSF has tremendous resources internally. When you go outside, obviously, some of your professional CPA advisors probably can help, or other advisors. Is there a network that you use to help kind of address those issues other than going to your MAC directly on questions?
Yeah, we're engaged with a couple of different, in full transparency, we have Eide Bailey on retainer to help with some of the pieces of it, as well as a couple of other firms. As far as professional associations, there's the problem with them is that it's not necessarily a network of solid resource that know how to get you from where you're currently at to where you need to be. They have what looks good on paper, but you need to develop that skill set of how do I build the bridge to get there, and there when we delved into this like broad stream about 18 months ago, there really weren't a lot of other Epic providers out there that had successfully built it out to a point that they were comfortable with, and they were still finding issues, months down the road where they're either having to go back and self-disclose or return payments because they erred in some way. And we didn't want to go down that route where, a self-disclosure, they happen, but they're obviously not your favorite thing to have to do. So we wanted to avoid that. So we were very deliberate and intentional in the build. We spent a good deal of time testing it in our test environment to kind of trace step by step, okay, if this piece of automation triggers these three elements, what happens downstream from that? And when you get downstream, what are those actions triggering? And then how does it cross over? What's the impact of reimbursement? And at the end of the day, does everything come back clean and can be reconciled in a compliant manner? So I would hope, I know that other systems are and have been actively reaching out to us to understand the build a little bit better, but I don't know that there's any one great resource that's out there that you could go to as your source of truth and say, hey, this is what I want to do. I've got, I'm hiring, contracted providers in Florida, Texas, Colorado, and, Washington State. What do I need to do? Yeah. And then map it out.
Yeah, and that's what I thought you were going to say. There's still a lot of trial and error out there, trying to learn and develop something that works, and then obviously using your internal resources and resources where you can. So, no surprise there. I think that's what we're hearing from a lot of people as they head down that journey, right? So.
Yeah, and it's going to. I would imagine we're starting to see I think they're calling it the Great Physician Resignation or whatever. Where a lot of providers they no longer want to work in brick and mortar. They want to work from their vacation house in Florida or from somewhere that is warmer than central Illinois, maybe less rain, less snow, I don't know, but they want to be in a different climate, and that's not isolated to just OSF or Illinois. It's something that we're seeing trend nationwide, and this need and demand for telehealth is going to continue to grow exponentially. So there needs to be resources to help providers build it right, get it right, and mitigate that risk.
Great. Before we go to Jenny, I think we need a polling question too, Maya. Is that Maya right there?
Yes, let me bring this up. All right, everyone, if you are here for CPE, we do have our second polling question up. If your media player screen is maximized, you can go ahead and minimize that. So your slides box is now maximized. Make sure your slides box is up. You are able to see the polling question. You are able to answer right from the screen, and then make sure you scroll down just a bit to hit submit. Please make sure you are submitting your answers after you make your selection.
And great, while we're doing that, I might kick it over to Jenny. I'm certainly really interested from a governance perspective and a board level, certainly hearing some of the many issues that are out there from a regulatory standpoint, how you view risk and how you think about risk, particularly in the healthcare world. And I think you already talked a little bit about the difference in healthcare versus other industries. So while they're answering questions, I think we can maybe jump into that.
Yeah, great. So when, my perspective is on the board of a relatively large for a very, very rural system. Our service area is 12,000 square miles, and we're the only level 2 trauma center in that. And so from our perspective, we've got a 15-member board. It's about making sure that our communities, and there's 4 counties that rely on us, have these kind of healthcare services. And if we don't succeed, it is going to be a tragedy for a lot of people in a very large area. So when we look at the risks, it's all about how do we keep going? How do we stay doing what we're doing and providing the care that we're doing and staying strong? And it always, at the end of the day, does come down to how strong are we financially? And, you know, our balance sheets, the industry balance sheets have really taken a hit. So right now, focused on capital and making sure that our balance sheets are strong and making sure that our plant is not getting too old. Our property and plant is not getting too old, is big. But we have lots and lots of risks coming at us. We're a $6.6 trillion industry as a whole in our nation, and we've got private equity starting to compete with even us. I mean, we're in the middle of nowhere, in the middle of Washington State. You can't get to us without driving miles and miles. And we are competing with Walmart, and we are competing with Amazon, and we are competing with some of the insureds. So that is probably one of our biggest risks, is making sure that we can compete with these new players that are coming into our space. From a board perspective, we can't just focus on any one risk because the risks come from all different places all over. So we as a board focus on what is our risk monitoring system. And that's when I think of risk, I think of how are we structured? What systems and processes and communication plans do we have in place to make sure that we are constantly vigilant for whatever risk it is, and that the decisions that are made about what kind of tolerance we're going to have for that risk are good, solid decisions that could be defended to any regulator or in any lawsuit. That's the perspective that I come to from risk. And so I always end up getting back to what is our process? How did we make those decisions? How were they communicated? And how did that information get up to the board?
No, that's really good. And I think in our audience, we've got people that are reporting to boards. We get, as I mentioned, CFOs, COOs, compliance officers, those sort of things as well. So I think those are really important thoughts. Jenny, you know, as you, and again, in your role, there's probably only certain things you can say specifically, but kind of what are the big topics you talk about at a board level right now? 3 biggies or 5 biggies or 1 biggie, if there's one you always talk about.
Well, I bet they're not different from any, number 1 is capital and cash. Like, what do our capital levels look like? That is our fortress. That is the bricks that we hide behind. The next one is retention and recruitment. Huge, tough, especially in a rural environment. And so how are we staying strong? Because that is the army with which we are going to defend our fortress, is recruitment and retention. The other areas that we're really focused on is, the legal environment is really changing in some pretty significant ways. States are starting to get involved in banning certain procedures, banning certain medications, and we all of a sudden are struggling with new ethical decisions and how are we going to stay compliant with a regulatory and legal environment that is really shifting and unclear. So that is another area that we talk about. And then, of course, this digital transformation that dovetails with these huge players that are coming into our space, which is the Amazons and the Walmarts and the CVSs. They are fueled by mastering standardization and digital transformation. And traditional hospitals and healthcare systems, those aren't generally our focus. Those are sort of the tools with which we do what our focus is. They're coming at it from standardizing first and then deciding what services they're going to go after. And oh, by the way, the only services they're going to go after are the ones that are profitable for us. So those are some of the things that we discuss in the board.
Right. Well, and I think, not only discuss, but try and figure out what the roadmap of the future is, so you don't, have that seepage of, profitable services, how to implement, how to implement digital, quite frankly. And as I've talked with some leadership recently, I mean, I think all the organizations are spending time in that area. I'm not so sure. There's been a lot of real great success stories. People are investing money in it and trying to find some small wins, whether that be in revenue cycle and identifying issues, automating certain things that are out there, or trying to monitoring, from a productivity standpoint. But I think it's been, maybe spotty from the perspective of success stories right now. I think I know the answer to this, but you've been on the board, I think, 11 years. So what's changed? I mean, what are the biggest changes? I mean, is it that? Is it competition? Is it all those? As you sit and talk about risk and strategy.
Yeah, well, certainly technology is always advancing. That would be different for whatever industry you're in. But what has absolutely changed for us is the potential for serious, very fast and agile competition, which has been brought about by the digital era. And that has changed. The other thing that has changed is that we've really recognized that we have to put our big boy pants on, and we've really got to start standardizing. We like to think of ourselves as this very touchy-feely rural healthcare system where we have personal relationships with all of our patients, and which is very true. But we at the governance level have a responsibility to start standardizing our processes and our care and our controls, so that we can be confident that we are covering all of the bases everywhere. Christine mentioned it. A large healthcare system has this challenge too. You've got these smaller business lines, but they have to have the same kind of controls. They have to have the same kind of risk management as your bigger lines. And so standardization and pushing management and provider teams to standardization has been a big part of the work that we've done in the last 11 years, and it's no fun. Nobody wants to be told how to do something, especially not providers. They want to practice medicine the way they want to practice medicine. But in order for us to keep our fortress healthy, we've got to standardize our processes, and we've got to standardize our decision-making.
Great. I'm going to kind of go over to Christine, only because I know she talked a little bit about these, for lack of these maybe unique or non-core activities, businesses otherwise, and observations or things that risks you've seen with respect to some of those areas, and kind of taking off of what Jenny mentioned too. Are we?
Christine, we're not able to hear you. Are you on mute?
Oh,
there you go.
Can you hear me now?
Yes, perfect.
Yes.
Okay. I think that one of the biggest risks is they have not had the same rigor applied around the control structures that the larger institution as a whole has had. And so therefore if you think about compliance, like I do, you think about the maturity level from a compliance perspective. Well, the organization as a whole, or the hospital part of the organization, may be fairly mature, and we can have really involved institutional risk discussions, which I think you have to have a certain level of maturity to figure out what are we willing to accept as a risk tolerance. When you go into some of those non-core businesses, you may find from a compliance maturity level that they are back at everything is informal, nothing is written down. And so then when you have to produce something for some outside party for whatever reason, you don't have a lot to show from that perspective. And so then get sort of helping to build up that maturity level to that same piece so that you can have those same kind of risk discussions that you have at the, within every sector of the business.
And I've seen situations, to your point and Jenny's point, about no one likes to be told, here's what we're doing now, policies and procedures. It's difficult, but I've seen situations where in an acquisition of one of these, maybe what would be considered non-core, where there was some pervasive issues, compliance issues, that was very small piece of the very small piece of the entire health system. But when we started looking at the compliance issues that went back many years, it became pretty significant and pretty significant dollars. So it's not something that you can ignore either. And some of these activities could end up being a pretty large financial risk if you're not careful. So, well, go ahead. I'm sorry, Christine. You're going to say something.
I was just going to say I agree, and I think from a governance perspective, I think there's two pieces. One, depending on the structure of the acquisition, you've got the due diligence side to evaluate sort of those past risks. And even if you're not acquiring the liability, depending on the structure, you certainly want to have early on a risk evaluation of sort of how those providers act in terms of the standard process that you've defined.
Great. Maya, I think we'll go to the third question here since we're nearing 15 minutes to.
Okay, we have that third polling question up, everyone. Make sure your slides box is maximized so you are able to see the polling question. Yes, the polling question. You will make your selection right on the screen, and then make sure you scroll down just a bit to click submit. Make sure you are clicking submit so your selection counts.
And maybe while we're doing that, CJ, I know in some of our discussions you mentioned earlier a little bit reimbursement revenue side of the equation. Could you talk a little bit about, besides what you've already talked about, some of the focus plans you have going forward, or where you're spending your time in that area?
Yeah, and I think, at the end of the day, everything comes down to payment for the services that you're rendering, because that's always going to be the target of the enforcement agencies, whether it's a RAC, a MAC, a Medicaid integrity auditor, the OIG. It's all payment based for the most part, as far as where the risk starts. Was the payment appropriate? So for OSF, the way we built our compliance program, the division itself houses both compliance and internal audit. Our audit team is broken into two separate teams. One is compliance audit, the other is internal audit. So obviously internal audit is looking more at processes. Compliance audit is more looking at whether it's clinical documentation, medical necessity, any number of different criteria. But the way we kind of build our annual compliance plan is looking at a lot of actually readily available information that's out there. What's on the OIG watch list? What are the published RAC targets? What are we actually seeing in the industry as a whole? Then the next step to it is to kind of socialize some of that stuff with key leadership across our ministry to kind of gauge a sense of what is keeping them awake at night, and areas that they feel there is risk. And then based on all of that input, we pull it into this massive annual work plan, annual compliance work plan. And for us, for OSF, it has been a much more successful initiative after having moved to this kind of model about 5 years ago, than just you can't just throw an arrow in the dark and think that you're going to land on what it is. And you definitely cannot be reactive. You absolutely have to be proactive. And no, you're never going to mitigate 100% of every risk, but if you can demonstrate that you have an effective, comprehensive compliance plan in place and your program has solid governance, you're doing everything that you believe that you can to mitigate risk to, the Medicare program or any other trust that might be seeking to penalize you as a provider. It carries a lot of weight when you go into those conversations and, say you do have to have that self-disclosure or make that self-disclosure, but you can effectively demonstrate that you've been monitoring some aspect of this. You might have missed one piece of it. Mm-hmm. And that's where that flaw was. And the odds of having an extrapolation penalty on top of whatever you're paying back are slim to none, because you can demonstrate that you're trying and you've got an effective program in place. And it really is key.
No, that's great. I'm going to respond to a couple items in the chat real quick. We got some comments that people would like to check off more than one on this question. So if there's some other, second choice, feel free to email them or put them in the chat too to add. And we really are trying to use this for future webinars and tailor things to people. So CJ, no, that's great. I want to kind of go to the governance side of things, both your role and how Jenny views governance and from a standpoint of what she gets, what she'd like to get from a compliance, internal audit, other risk management processes. So maybe I'll throw it back to Jenny real quick and maybe give the group your thoughts, because I think this applies to whether you're in a compliance role, internal audit role, CFO role, director role, kind of what your views are of some of the reporting and information.
So from my perspective, if we aren't talking about the scary stuff and the risky stuff in the board meetings, if the board meetings are just reports out that look good or, are just standard metrics that we see every month, and there's not discussion of the real challenges that the executive team or that the organization is dealing with, then something's not working. The board should be hearing about this, about the risks, about the concerns. And that's been something that we've had to really push for, because I think that a lot of management teams, they don't want to necessarily bubble something up to the board if they don't have it completely baked. But CJ's right that it's all about, do you have a system in place where you're trying to monitor and gather this information? And do you have a system in place where you're bubbling that information all the way up to those charged with governance? And if you are, it is true, there's going to be black swan events. There's going to be things that we don't expect. There's going to be a pandemic. You still will have a defensible situation. But if management's just reporting general metrics and getting bonuses and the board is not challenging them, that's when you've really got some issues. One of the biases, even if you're just in a board meet, at the board level, but even if you're in any kind of meeting, you have to guard against certain biases that really can put you at risk. The bias of groupthink, where everybody thinks the same thing and people are afraid to speak up. That is a danger. That is a risk that is embedded in your organization, and it could pop out in any particular area. The status quo bias, you know, it's working, let's just keep doing the same thing. We don't rock the boat. It's going to be too much trouble to change. That is a risk. So these kind of biases. Oh, and then authority bias is huge, especially if you're in meetings when there's different levels of people in the organization. If everybody is deferring to the highest ranking person in that room and they're not sharing their real opinions and insights, something is not working. And that's true no matter what level of the organization you're at. And so those are all parts of a strong risk management system, is guarding against those things. But it does start with creating a process. And the one that CJ defined is exactly the kind of process that we endeavor to have at Confluence. And we've used the American Society for Healthcare Risk Management to really help educate our employees and our managers on what a proper risk management structure should look like. So that's been very successful for us to implement a reporting system and a monitoring system that allows the board to be involved in decisions about risk tolerance. Because at the end of the day, we do have to decide how much risk we are going to accept, but the board needs to be involved in those decisions.
Yeah, I really like what CJ said too, and what you reiterated, which is, you know, the extent if you have a process that is, you know, organized, rational, does something to inventory your risks, you can at least then from year to year basis, on year to year basis, identify where you are, what you've addressed, have a defensible position as to why you went in the direction you did as far as your plan goes. And then you adjust, you know, as you go next year, but you've got that in front of you, and rather than, I think as CJ mentioned, throwing the darts out there because something else popped up here, something pops up there. What you're not addressing is the things you're not thinking about on a daily basis. So that's great. We've got
Scott,
Yep, go ahead, CJ.
No, I was just going to say, if I could tag onto one Jenny's list of all the reasons like we shouldn't do it this way. One of the biggest ones, and it's one of my biggest pet peeves, is, well, everybody else is doing it this way, or nobody else tries to comply with this. And that is one of the most ridiculous arguments and it frustrates me to no end, because just because everybody else is doing it wrong doesn't mean that it's okay for us to deliberately be wrong. So a lot of it is about changing the culture and the mindset of the people in that culture to get them forward thinking. Yep.
And sometimes it takes courage, right? To change the way you've been doing things and stand up and say, this is how we need to do it. So with about 5 minutes left, I think I'm going to start with Christine, and maybe final thoughts on governance or anything else. And then we'll be able to wrap up. I think we have one more poll question to wrap up for the audience and get everyone on their way by the top of the hour. So, Christine?
So one of the things, I know that a lot of people talk about resource constraints, and I think that as you work on risk, trying to, on an operational perspective, trying to ensure that the process that you have has the controls in place to mitigate the risk, rather than it being a step on top of the process. Because that every time something's a step on top of the normal thing, I think it's not going to be sustainable. And I think that causes extra resources to be spent. And so this idea about trying to really think about that within your framework to try to help you think about managing those resource constraints, but still meeting the requirements from a risk perspective.
Great. CJ? Any final thoughts or observations?
I think Christine kind of wrapped it up very nicely. put a very nice bow on it. I feel like the conversation this afternoon has been very, very good. We know that there's risks everywhere in healthcare, and our job is to mitigate as many of those risks in an effective and timely manner as we possibly can. And we need the collaborative voice of all, whether it's at the board level, at the leadership level, if it's at our regular frontline staff level. If something doesn't look right, if it doesn't smell right, raise the flag.
Great, thank you. And Jenny?
I don't think I have anything super great to add, because they did really wrap it up very well. You know, at the end of the day, it does come down to everybody who's in a role saying what they really see and saying what they really believe. And that can be a very difficult thing to do, no matter where you are in the organization. But it is the number one way that you can protect the organization from, you know, really dire consequences. So I just encourage people to speak up.
Yeah, and there is, you know, there's, as we've talked today, there's so many different things coming at the industry right now. So it is hard to stay on top of them, and I think that communication is important. Having the opportunity to work a little bit with Jenny, I know from a board level perspective, you know, best practice for people that are on the board or management is building relationships with management and other providers of services, so that, you know, you do have that open line of communication. So I think that's always important as well. So with that, Maya, I think we do we have one more polling question for the group?
We do.
This is a tough one.
Everyone, if you have met your CPE requirements, you see the earned certification box on the right-hand side. You are able to scroll down just a bit in that box and hit view certificate, and you are able to download your certificate right from there. And also, don't forget, we do have our PowerPoint handout link that is in the related content box. You can go ahead and click on that and download the slides of today's webinar.
I'm going to grab one slide as a reminder. Please go ahead and consider joining some of our future webinars. Certainly, we will try and build some of these thoughts into it. I did see some of the feedback on things like data automation, so we'll certainly consider that in future webinars as well. And I'd like to thank all the panelists. Thank you very much for supporting this educational opportunity for everyone. And the rest of you, have a great rest of the week and weekend.